Good morning, viewer. Welcome to our FTV. Viewers, a new outpatient procedures could help people about regaining weight after stopping popular medications like Ozempic and semaglutide. According to research to be presented at Digestive Disease Week 2026, experts estimate that about 70% of people who discontinue all these drugs regain a much of the weight they lost, often within 18 months. Only 1 in 5 adults with obesity has used a glucagon like a peptide one that is called GLP-1, underscoring how widespread this issue has become. The study provides the first blinded, randomized, controlled evidence that a technique called duodenal mucosal resurfacing may offer a safe and effective way to maintain weight loss without continuing medication. And the findings suggests it could help people preserve the benefits they achieved while taking drugs like semaglutide. Viewers, as effective as GLP-1 medication are many people stop taking them because of cost, side effects, or simply are not wanting to take a drug long term, said lead author Selby Sullivan, MD, director of the Endoscopic, Bariatric and Metabolic Program at Dartmouth Health Oil and Oil, Weight Center, and professor of medicine, Dartmouth Geisel School of Medicine. But if they stop this medication, weight regain occurs in the vast majority of patients, and the metabolic benefits are lost. Finding a treatment that allows patients to stop these medications without weight regain or loss of metabolic benefit is a huge unmet need. And these findings indicate that these minimally invasive procedures may provide a lasting weight loss maintaining. Viewers, duodenal mucosal resurfacing is an investigational endoscopic procedure that uses controlled heat to remove damaged tissues from the inner lining of the duodenum, the first part of the small intestine just below the stomach. So this process ablates, that means burn the unhealthy mucosal layer and stimulates the growth of new healthier tissue. The Remain one trial is evaluating whether this renewal of the intestinal lining can trigger a lasting metabolic reset, helping the body maintain weight loss after stopping medications like Ozempic, semaglutide, and tirzepatide. The results come from the first group of participants with 6 months of follow-up, and in this midpoint cohort of 45 people, 29 received the resurfacing procedures and 16 underwent a SAM procedure. All participants had previously lost at least 15% of their body weight using tirzepatide before discontinuing the drug. On average, patient lost about 40 pounds during GLP-1 therapy 6 months after stopping treatment. Those in the control group regained significantly more weight. Participants who were the SAM procedures regained about 40% more weight than those who received the actual treatment. Those who underwent the most extensive resurfacing regained about 7 pounds, maintaining over 80% of their original weight loss. So, in contrast, the control group regained roughly twice as much, and the gap between the groups continued to widen from 1 to 6 months after the procedure, suggesting the effect may be durable. We have this exclusive report.